many staff members who are concerned about how the vaccines impact reproductive health. Both women who may be pregnant, breastfeeding, or trying to become pregnant, and men who want to start a family are wondering if these vaccines will cause long-term side effects or birth defects. What does the current research say, and what is the recommendation for adults of childbearing age?
Yes, my name is Meski. I'm the medical director here at Prince George's Department of Correction. I'm more than happy to answer all these COVID-19 vaccine-related questions today. I think you raised an excellent question. This is one of the most commonly asked questions on CDC guidelines when it comes to COVID-19 vaccine regarding its safety for childbearing age. It is very clear that the messenger RNA vaccines, Pfizer and Moderna, and the vector-based vaccine, Johnson & Johnson, they do not alter the DNA of the host, or a human DNA, or they don't modify or change the genetic material. Therefore, they're absolutely safe for any childbearing age. So those women who plan to be pregnant or who are already pregnant or breastfeeding, they can safely take the COVID-19 vaccine. The same goes for men who plan, to have a child. It will not affect your genetic makeup. It doesn't change the genetic material. Therefore, it is safe to take. In fact, CDC put pregnancy as a high-risk category. Then since COVID-19 infection causes severe illness, hospitalization and death among pregnant women who are not vaccinated. So it is highly recommended that pregnant women get vaccines.
One thing that people find very confusing is the idea that it is still possible to get COVID even if you are vaccinated. They think, what's the bother getting the vaccine if this is the case? Can you explain a potential positive test result for someone who has been fully vaccinated, and why is it still important to get vaccinated?
Yes, it is true. This is an excellent question as well. People who are vaccinated for COVID-19 infection, relatively, they are protected. It is the most protective vaccine that we have. However, even if you are vaccinated, you can still have a positive COVID test because you are still carrying the virus, and the test can be positive. Or you might have mild symptoms because of COVID infection after you took COVID vaccine. So such symptoms could be just mild, headache, fever, body ache. However, studies are showing that people who are fully vaccinated for COVID-19 infection will not get serious illness that requires hospitalization, intubation, or death. Therefore, yes, you can still have COVID infection after you take COVID vaccine. You might just be a carrier having the virus without getting sick, or you might have mild symptoms, but you will not get seriously ill. That's why it is extremely important to take the COVID-19 vaccines. However, you might know people who just took the COVID vaccine and got seriously ill and died. This is because it takes 2 weeks for your body to produce enough immunity to fight the vaccine after you're fully vaccinated. In other words, if you take Moderna or Pfizer, you should the body waits 2 weeks after you take the second dose of the vaccine in order to have a good immunity to fight the infection. So if in 2 weeks after one dose of Johnson & Johnson, because you only take one dose of the Johnson vaccine. So if someone, for example, takes the vaccine today and they get seriously ill and die 6 days after they took the vaccine, it is not the vaccine that caused the illness, or it is not the vaccine that didn't protect them and they got seriously ill or die from it. It is because there wasn't enough time from the time they took the vaccine until the body produces enough immunity, which is typically 2 weeks, and they got infected right after they took the vaccine. So the body didn't have enough time, that 2 weeks time, to produce immunity and fight the virus. So That's why we strongly recommend after you take a COVID vaccine, since you're not out of the woods the next 2 weeks until your body produces enough immunity to fight the vaccine, still keep your mask, keep your social distancing, and frequent hand washing and sanitizing. After 2 weeks, your body is ready to fight, then you can ease on those things when you are among people who are vaccinated.
Good answer, Doctor.
And also recently it was on the news, was it 3 days ago, when CDC tracked all the deaths related to COVID-19, all of them were unvaccinated people. Right there it tells you that when you see deaths from COVID-19, it is amongst people who are not vaccinated.
What is a safe period to take the vaccine after having contracted COVID-19?
Yes, the safe period to take COVID-19 vaccine after you got a COVID infection is typically to wait until you come out of quarantine. The current recommendation by CDC is 10 days after the first symptom of COVID, 10 days you remain in quarantine, and after afebrile or no fever, 24 hours after no fever without taking fever-reducing medication, and the symptoms of COVID vaccine subside, at that time you can take COVID-19 vaccine. Now, we don't have to retest and find a negative COVID test in order to take COVID vaccine after COVID infection. It's not necessary, simply because people can continue to have a positive COVID-19 result up to 3 months or even longer. So you can continue to be positive way after you came out of quarantine. So you don't have to wait 3 months to get the COVID-19 vaccine. Once you come out of quarantine after 10 days and more than 24 hours since you had fever without taking medication and the symptoms subside, you're good to take COVID-19 vaccine.
People with severe allergies are concerned about having a reaction to the shot. What is the recommendation for those with known allergic reactions?
Actually, this is one of, again, the most commonly asked questions on the CDC guidelines. Overall, CDC is recommending that people with severe allergic reaction in the past, taking, other medications or other vaccines, they still recommend to take COVID-19 vaccine. The only exception or contraindication they put there is if they have been allergic to messenger RNA vaccines in the past and they had severe reaction, they should not take these vaccines. I was doing some research and I'm trying to see if there were other messenger RNA vaccines that were out in the past that people might have reaction to it so that they will remember and say, I cannot take this. But I couldn't come up with one. So literally, anyone who has history of penicillin allergy, sulfur allergy, or other severe allergies, they can still take the COVID-19 vaccine. But when we are ready to give vaccines, we always have epinephrine, EpiPen. For those people who have severe allergic reaction, we give it right away. And the allergic reaction can happen in the first 4 hours. But for the most part, it is safe to give it to people with severe allergic reaction to other medications.
As with those with known allergic reactions, there are people with underlying health conditions that are concerned about how the vaccine will impact their immune system. What is the recommendation for them?
Yeah, the CDC recommendation again is people with immunosuppressive, low immunity or immunosuppressive illnesses like HIV, cancer-related autoimmune diseases, or people on medications that are immunosuppressant. They are high-risk group for COVID-19 serious infection and death. So actually, it is highly recommended that this group with immunocompromised group be vaccinated for COVID-19 vaccine. So there is no any study suggesting that the COVID-19 vaccine actually will lower the immunity or predispose them to more serious illness. It is the other way. They need to get it.
People have heard that the Moderna and Pfizer vaccines that use the new mRNA technology may alter your DNA. Can you briefly explain what the vaccine actually does?
Yes, this is an excellent question. As I explained earlier, the two vaccines, Moderna and Pfizer, are mRNA vaccines. That means these vaccines will stimulate our cells or teach our cells to produce special protein, we call them spike protein, to fight against the COVID-19 virus. So it is not altering our DNA, it is not changing our genetic material. Instead, it is teaching our cells to produce the protein that fights the COVID-19 virus.
A fair number of people who've worn masks, socially distanced, and not gotten COVID wonder, why do they need the vaccine if the positivity rate has declined significantly and they haven't gotten COVID thus far?
That is an excellent question. I didn't get vaccinated. I keep my mask on, social distance, and so far I didn't get vaccinated. Why am I taking vaccine now when the rate is going down? This is interesting because there is a surge of COVID vaccine infection in certain part of the country, and unfortunately the kind of COVID-19 virus, the variant, is the Delta one. That is the one that came from India, the Delta one. It is more infectious and it causes more severe illness. And it is mostly the younger people under the age of 40 who are dying from it. So we are seeing pockets of surge in increased COVID-19 infection with Delta variant in unvaccinated population. So it is more reason for those people who waited this far to get more vaccine, to get COVID-19 vaccine now, because the kind of COVID-19 virus that is out there is the mutant kind. It is the variant, the Delta variant. It is the most contagious, it is the most fatal. So it is more reason for unvaccinated people to get on it.
So, Doc, is there anything else you want to add?
Yeah, I think there is a recommendation. I think the Maryland governor recently said starting July 1st, you're not required legally to put on a mask or, social distancing. That means, enter at your own risk. If you're vaccinated, you're protected. If you're not vaccinated, I don't see where you'll be protected anymore from anyone, because if they're not obligated, people are going to take off their mask. I think it is more reason for people to get vaccinated, because you don't know who is next to them and you cannot ask, you cannot prove. So it is more reason to get the vaccine now, since all this thing, the emergency is taken off and people are going to walk around without mask. It is more risk now. That's why I think it might not be mandated to be vaccinated, but I think it is the wisest thing you do to protect yourself, not only yourself, your loved ones. Because when you are vaccinated, when you are fully vaccinated, the chance of you transmitting the virus is extremely low. So you're not going to take it to grandma, you're not going to take it to, a sick person at home, or immunocompromised or high-risk people, or to pregnant women. So you're protecting not only yourself, but also others. So it is more reason to get on it now, in fact, before everyone takes off their mask. That is my recommendation. Tuesday, Wednesday, and Thursday, we're having a clinic here. I think it's all day to cover all shift. Just stop by, take the vaccine, and as you said, the next 2 weeks, I will still keep my mask until I produce enough immunity. Then you can take it off.